Hello, you're welcome to yet another recording. Today I'm sharing about the things I learned, just a brief summary of what I've read about acute otitis media. So, just 1 minute, please. Now, I'm going to be using the outline before us today. I'm going to be talking about what is otitis media as an introduction. What are the causative organisms? What are the symptoms? How is this managed? And what are the complications? Now, acute otitis media can simply be defined as an inflammation of the middle ear. Acute otitis media can be defined as an inflammation of the middle ear. It is extremely common in children, with around half of the children having 3 or more episodes at the age of 3 years. What are the causative organisms? Now, we know that viral upper respiratory tract infections typically precede otitis media. But even at that, most of the infections are secondary to bacteria. And the most common bacteria are Streptococcus pneumoniae, Haemophilus influenzae, and Moraxella catarrhalis. Now, those are the commonest organisms. How does a patient with otitis media present? We could have otalgia, we could have fever, we could have hearing loss. The patient could give an history of recent viral upper respiratory tract infection, and the patient could have air discharge. On examination, you might be able to see bulging tympanic membrane. With loss of the light reflex, you might be able to see opacification or erythema of the tympanic membrane. Some patients might present to you perforated, and if you're using pneumatic otoscope, you might be able to notice decreased mobility. Now, how do you manage? Now, a lot of people prescribe antibiotics when they see a patient with acute otitis media. Acute otitis media is most of the time a generally self-limiting condition that does not require antibiotic at all. So what we usually do is, if we see a patient with acute otitis media who is not really toxic, can go on analgesia, we just give them analgesia to go on with, and we follow them up in 3 days. For patients that are still symptomatic, still unwell after 3 days, we give them antibiotics. Apart from this, there are a couple of conditions in which we give antibiotics, particularly antibiotics from the start. This scenario that I described for you is what we do in majority of patients. But in some patients, we give antibiotics immediately. Patients that are systemically unwell, patients that are immunocompromised, patients that are younger than 2 years with bilateral otitis media, and also in otitis media with perforation. The usual antibiotic we give is amoxicillin. In patients that are penicillin allergic, we can give macrolides in form of erythromycin or clarithromycin. Complications of otitis media include perforation of the tympanic membrane, hearing loss, labyrinthitis, mastocytitis, meningitis, brain abscess, and facial nerve paralysis. So thank you very much for listening to this short video. I will see you another time. Thank you so much. Bye.